Hi everybody, and welcome to our next module where we will be learning about the lower leg, which is going to consist of the anatomy and positioning of the tib fib, the knee, and the patella. Alright, looking at the tibia and fibula in the anterior view, so looking at it from the front, I'm going to review primarily more of the proximal portion of the tib fib since this is new anatomy to you guys. The distal portion is old anatomy since you have already learned the ankle joint. So just as a reminder, the tibia is the weight-bearing bone of the lower leg. To start, more looking at the front of the tibia area, we have the anterior crest, which is going to be the crest on the anterior portion of the shin that pretty much extends from the tibial tuberosity to the medial malleolus. So as you can see, this kind of like raised crest area that's going pretty much down the entire front of the tibia. Starting more at the top up here, we have the tibial plateau, which is going to be the upper articular surface of the condyles. That includes two small concave articular facets. This is pretty much where the femur is going to sit. So these two flattened portions right here are going to be the tibial plateau. When we start to learn the knee, you're going to notice that when we do an AP knee, we will be putting a small angle on the AP knee, which is going to be essential in demonstrating an open joint space for this AP knee. In the middle of that tibial plateau, we have something called the intercondylar eminences, which include two small pointed prominences that you can see. We have both a medial and a lateral tubercle. Moving down slightly, we have the medial and lateral condyles, which are going to be two large processes that make up the medial and lateral aspect of the proximal tibia area. The tibial tuberosity is going to be located at the proximal end of the tibia and is a rough textured prominence located on the mid-anterior surface, just distal to the condyles. So that's going to be right here. Again, that's kind of really the top of the anterior crest. A lot of the times you can actually palpate where this tibial tuberosity is. And then looking more towards the distal portion, just quickly, it ends in a short pyramid-shaped process called the medial malleolus. The lateral aspect forms a flattened triangular fibular notch for the articulation with the distal fibula. So this picture here is looking at the tibia and fibula in that lateral view. One thing I just want to point out, the tibial plateau, which is the top of the tibia, as you can see, it's pretty slanted. So when we talked about doing that AP knee, we actually throw an angle on that AP knee so we can see the joint space nice and open. Again, we've pretty much learned the distal portion of the fibula now, so I really want to focus more on the proximal end of the fibula. So the fibula is going to be located laterally and more posteriorly, as you can see in this picture. It articulates with the tibia proximally at the tibia and talus distally. The proximal extremity is expanded into a head which articulates with the lateral aspect of the posterior inferior surface of the lateral condyle of the tibia. And then the proximal fibula is going to have the apex, the head, and the neck, as you can see in this picture. We have that body, which is going to be that long slender area between the two extremities, and then lastly it kind of ends in that lateral malleolus, the enlarged distal end of the fibula, which is pretty much the distinct bump on the lateral side of the ankle. So since we are only learning the knee in this module, we really only need to focus on the distal femur anatomy, which is going to be located here. All of this we will focus on in our next module. So starting out looking at more of the anterior portion of the distal femur. To start, the patella is going to be the largest sesamoid bone in the body. So as a reminder, a sesamoid bone is going to be a bone that's pretty much just held on by tendons and muscle. Looking at the patella surface down here, it is going to be the smooth, shallow, and triangular depression at the distal portion of the anterior femur that extends up under the lower part of the patella. You're going to hear this depression is sometimes referred to as the intercondylar sulcus. Now looking at the picture on the right, this is really going to look at the distal portion of the femur kind of from the back. you're going to notice there are going to be two large rounded condyles that are separated distally and posteriorly by a deep intercondylar fossa. So you're going to notice we're going to talk about the distal portion of the femur. You're going to notice that they have condyles as well as epicondyles. So please make sure you do not get confused. And then also remember the tibia also has condyles. So let's start. So that intercondylar fossa, or that deep depression, is going to be right here. It's going to be separated by rounded condyles on each side, which is going to be the lateral and medial condyles. These contain the smooth articular surface for the articulation with the tibia. So think of this portion right here, and here articulates with the tibia. You're also going to notice the medial condyle extends lower or more distally, which is why a 5 to 7 degree cephalad degree angle is going to be used for a lateral knee when we learn lateral knees. Lastly, the medial and lateral epicondyles can be palpated and are located on the outermost portion of the condyles. They have rough prominences for attachment of the medial and lateral collateral ligaments. So, looking at the distal femur, we have to start at the top, we have the lateral epicondyles and then the lateral condyles, and then moving down to the tibia, we have the tibial condyle. So make sure you can identify all of these, especially the epicondyles, the condyles, the intercondylar fossa. I don't really get too worried about the popliteal surface or the abductor tubercle in this picture. And then also take this information here and be able to label it on this picture over here. Last but not least, we need to review the patella. Again, the patella is the largest sesamoid bone in the body. The patella is a flat triangular bone. Something to note, the base is going to be the top where the apex is going to be the bottom. So make sure you know that. The anterior surface is going to be the rough and the smooth is going to be in the posterior portion. The patellofemoral joint is where the patella articulates with the anterior surface of the distal femur. Again, it's articulating with really tendons, muscle, no bone aspect is articulating with it. You don't necessarily need to memorize this picture. This picture is really just going over the 4 major ligaments that are within the knee. I feel like we all kind of have heard of these in the past because people do tear these playing sports, etc. But again, just take a look at this. I'm not really going to test you on this too much, memorization purposes. But it is nice to see, like looking at the patella right here, how it kind of articulates with the tibia, the femur, etc., being held by those ligaments. Again, this is another picture that I don't really need you to memorize too much. This is really just showing you what the articular capsule of the knee looks like. So on the right hand side, you guys might see these at your clinical site. This is a knee arthrogram, so it's just showing you the contrast inside the patient's articular capsule of the knee. And that's it for today's module lecture on the lower leg, which included the tib, fib, knee, and patella.